All right, 3, 2, 1, go.
Good morning, everyone. We're going to do this morning a little bit of demonstration on what we call donning and doffing of PPE, realizing that if it's not done correctly, essentially you have no protection. So I have to tell you, with N95s, the first thing I need to tell you is by OSHA standards, they need to be fit tested with either quantitative or quantitative analysis. However, the procedure for fit testing is going to be the same, and once we get done, we can show you how to do your own testing to make sure that your fit is appropriate. So we'll demonstrate proper donning and doffing of N95 masks as well as gloves. So an N95 basically is the highest level of protection that you can get. They are actually recommended for healthcare workers. Other masks are probably appropriate depending on what task you were doing, such as a procedure mask or a surgical mask. But N95s are designed to filter down microns to, I think, 0.3, which is pretty small, which gives you the highest level of protection. However, if not properly fitted and not properly worn, essentially then you increase the risk of not having the protection that you need. So essentially, you'll notice an N95 has two straps. The placement of the straps are critical in terms of getting the appropriate fit. So you just basically place it in your hand down. Obviously you should have hand sanitizing or hand washing prior to putting on your mask, and just into your hand, palm up, face piece down, nose piece out, and it just goes up like this. Then you take the second strap, and it goes on first. It goes down to just below the ears or the neckline. Then you take the second one and go up and over. You want to stop about the crown of the head. Then you can adjust your mask to where you think it feels comfortable. The critical thing is making sure that you get a good seal. The mistake that a lot of folks make is taking one hand and do the pinching. Do not do that. Take two hands, pinch the little metal piece into the bridge of the nose, and it's going to have to be pretty snug to get a good fit. You'll know you have a good fit. One, when you breathe in, you shouldn't feel any air coming around the mask. Likewise, when you exhale, you shouldn't feel any air coming out of the mask. Now, if you put your hand over it and breathe in and out, you should feel a little bit of a flex in the mask. That tells you that you have a good seal. Once you have a seal, leave it in place. Don't mess with it, because then you're going to break the seal. Now, one thing I have to tell you is that if you have any facial hair, you're not going to get a good seal. If you can't get a good seal for whatever reason, do not wear it, because then you're not going to have any full protection. So again, you should feel some movement in and out. No air around when you breathe in, no air around when you breathe out, and the flex should give you a really pretty good fit. When you take it off, again, you want to take the second strap up and over, keeping outward pressure on, and then take the top strap, keeping outward pressure on, up and over. By doing it this way, your mask stays intact until such time it's the last thing that comes off of your nose. Now, when you store these, they should be stored face down, preferably in a paper towel or something with your name on it that you're going to reuse them. We're going to discard this, but this is not an appropriate way to store your mask. What you don't want to do is you don't want to continually touch the outside of the mask. That's where any potential contamination would be. So if we store it this way and put the mask on such as this for reuse, that would be an appropriate method of storing. These are designed to be reused. You can use these multiple times as long as, one, they don't get wet, the fabric, the fabric is still yet intact, the integrity hasn't been compromised, the structure itself is intact, and you properly store them.
Is there a maximum amount of time you can wear it before you should take it off?
No. These are designed again to be reused. The most important thing is how you store them between uses. So again, you want to store them in a paper bag, preferably face down. See the paper bags that has the handles on it, so you can get some good ventilation. Now, in terms of how long will viral particles survive on this, if we go on the assumption that the viral particles are viable after 24 hours or less, then comfortably you can reuse this once in a 24-hour period. These can be sanitized in the oven if need be, and I believe that's at about 158 degrees for 30 minutes, then you re-sanitize them. So that's pretty much about it on terms of the mask. Again, they offer really excellent protection and should be used, but only if they're used appropriately. The most important thing is the fit. If you follow those procedures and then do your fit test afterward, then that will assure that you've gotten a good seal. So alongside that is also gloves. Now, there's a lot of, I guess, discussions around glove usage. What I want to caution you is if we have one pair of gloves and we use them all day or for multiple tasks, your hands get as contaminated, or your gloves get as contaminated as your hands. So if you have the ability to wash hands and use hand sanitizer, that probably is a better option. However, if you don't, gloves offer excellent protection. It's important to use gloves per manufacturer's recommendations. So the first thing you do is practice hand hygiene, either hand washing or sanitizing solution. One of the things that's important to note the fit of the glove. Now my hands are probably a little bit damp, so trying to go on here. And it really doesn't matter. Your hands are clean, your gloves are sterile, so it doesn't matter how you put them on. A couple of things to remember that when we do put them on, one, you should remove jewelry. Obviously the jewelry increases the risk of tearing the gloves. You need to have a proper fit. If the gloves are too small, then they're going to increase the risk of tearing. If they're too large, your dexterity is going to be off. And essentially, if it's really tight, it's probably too small. If it's real loose, a lot of wrinkles, it's probably too large. But the most important thing is to make sure that the gloves actually fit, and you decrease any risk of making sure that the glove stays intact and integrity doesn't be compromised. Gloves, the most important thing in gloves is how you take them off. And essentially, you just take one hand, and it doesn't matter left or right, just pinch it here and basically just peel it off in such a manner as that. Then you take your clean finger, stick it down inside the glove, and then the glove by just pulling it off. The most important thing is your gloves, your fingers will only touch the inside of your gloves. The assumptions are that the inside of the gloves aren't contaminated, the outside is. And then again, this is the inside of the gloves, so it's not contaminated, so then you just pull it off and then discard them. And then once you get that done, discard, then you either re-hand sanitize or wash your hands appropriately. I think if we do those precautions, we will have completed the objective of decreasing the risk of any kind of communicable disease transmission, no matter where it's bacteria, viral particles, or parasites, or anything. Those are the common methods of PPE and how they should be used to decrease the risk. Any questions?